Okay, so this video we're going to look at a little bit of a case study. This is Kellen, and he recently, just about 8 days ago, started to get some pain in his left knee. And it wasn't something that happened as a result of, oh, I landed on it awkwardly or I hit it. It's just one of those things that's kind of crept up. How did you say you felt it first?
I felt it first. It was very sort of achy, pulley, like lots of pressure in my knee. It didn't happen at like 1 second.
Right.
Like I knew when it happened. It definitely, throughout the day, I noticed, hey, something is wrong with my knee.
Okay. Did you wake up with it? Was it something that sort of crept up during the day?
Usually I do wake up with pretty sore and usually iffy joints, but usually a good warm up helps that, but the knee just sort of stayed in.
Right, so it didn't resolve.
Mm-hmm.
Okay. And now, so he's just very new into this, as say, just over a week, and you're modifying class at the moment,
Mm-hmm.
so you're not jumping.
Not jumping and no grand pliés right now.
No grand pliés. And turns?
Turns on the easy side, yeah.
Okay. And are you finding that you're getting any weakness in the knee, or is it just pain?
Definitely some pain and just a little bit lacking of stability and keeping on my balance on the left leg, yeah.
Okay. And do you get any clicking or locking of the joints?
Some clicking, not very often. It almost feels like when you crack your finger knuckles, sort
Yeah.
of similar to that.
And do you get pain with that, or is it just, you can just sense it?
I can feel it a little bit, no pain, but I can hear it and feel it.
Yeah. And does it kind of have that kind of, that's not good. We have this thing that we call anticipation of pain. So even if there's not pain, it's that kind of inner knowing that it's like, that just doesn't feel right. We want to, we treat that the same as if there is pain. So that you can see I'm kind of asking quite a few questions there. I'm going through a little what we call a diagnostic sieve, where we sieve through different questions to help us kind of figure out which structures of the knee might be causing problems. Be a good idea before watching this video to go and watch the one on the knee joint so that you know the anatomy of the knee, because some of the things we'll be talking about will be related to that, and you'll be more informed if you've had a little understanding of how this joint works. But obviously, essentially, it's where our thigh bone is meeting our shin bone. And I always say with knees never get into trouble on their own unless you hit them on something or fall on them. They're normally happening because something is going on below it or above it, and the knee's caught in the middle. Now, we have a little history of another issue, so tell us about that.
So about a year ago, I had a back injury from doing a back walkover with improper warm-up. And after going to the doctors, it was an inflamed disc. I believe my L3 or L4.
L3, 4.
And it was inflamed and I never got it healed correctly, and it just sort of flames and makes my lower back in pretty much some good pain if I'm not warming up or after lots of dancing.
So you have to really take care of it. Yeah, so there's another big jigsaw piece, okay? We already had a pre-existing back issue, which he's admitted didn't really resolve. We're all guilty of doing it, we know. But this is a good example of how sometimes if you haven't resolved one issue, it can suddenly, other things start popping up and you start thinking, I've got all these random things going on in my body, when actually there's actually a connection between them. So we want to have a little look at what's going on with this knee. So this is really just an exploration. We're just going to help you to put those jigsaw pieces together. I'm going to try and be not too kind of clinical hat on here, because you're not clinical practitioners. I want to show you what you can explore as a dancer yourself. But also, I will show you some of the things that might be done, because if you are getting an issue, it is good to go and have an assessment with a physical therapist or a healthcare professional who can, even if they just say, no, you're good, keep going, just do some stretches and strengthening. We don't want to take risks with the knees because they are very vulnerable as dancers, and if you get a knee problem, it can become more dramatic if it's not seen to. Attend to the whispers and then it doesn't have to shout, right? Okay, so let's have a look first of all. If we get you into a standing position, and you'll already see that he's a very tall gentleman, and obviously went through quite a rapid growth phase during his teenage years. This can be another jigsaw piece with knee issues, and we'll talk about that a little bit more when we get into some close-ups when we're on the table. But what we're going to do first of all is just look at some stability here. So if I first of all get you just on your right leg to do just a knee bend there. Good. Now we're looking, is that knee tracking over the foot? If you just do that again. Yeah, that's good. It's a little bit of a wobble, but nothing major. And the pelvis is looking relatively stable as he does that. If you just do one more, we're going sort of straight up and down. Pretty good. Okay. Now if we switch to the other leg, and you can already see just before he even does it, you see that like, oh, I've got to set this up. There's already that hesitation there, okay? So that tells us a lot. Okay, yeah, so this one, it feels awkward to you? Mm-hmm. Yeah, just try one more. And we see it's a little bit of wiggling, wobbling, and what's going on at this pelvis. If I actually get you to turn back to view, it would be easier for people. Spin all the way around, that's it. And just do one more on that leg there. And you can see we're kind of dipping here and rotating a little bit. So that would speak to a little bit of this lower back control that we were talking about, but it's also to do with the outside part of the hip. You can relax down there, so we don't want to stress out that poor knee too much. Sometimes you might experience a crack as you do that. Cracking will probably particularly when you're on one leg and all your body weight's there. So those are the sort of questions you always want to be asking. Is there clicking, locking? Sometimes the joint can actually lock itself either in a bent position or in a straight position. If that's going on, you definitely need to go and get a professional opinion because there may be something more serious going on with that. Just have a seat once more, and I'll just mention a couple of little pieces of anatomy here. Again, watch the knee joint video for more detail, but you can see nicely highlighted in blue on this model are the menisci. A meniscus is one, menisci is two. We've got these two little cups just on the surface of your tibia, your shin bone, and they're there to act as shock absorption, but they're kind of cartilage rings, pads that are there. And because of the twisting forces that we often put through our knees as dancers, they can get a little worn, inflamed. If you're getting clicking and locking, that's an indication that those menisci might be involved in the injury. If you're getting that locking, sometimes in severe injuries, and I'll do a whole video on this, but sometimes a bit of that meniscus can tear away and it's actually floating loose in the joint, and sometimes it gets caught there and it locks your joint up. But watch the video on meniscus injuries for more detail on that. But now let's go in and have a look at what's going on with this knee joint and see what our little where our detective story takes us. So if I have you lie down onto your back, he's way longer than this table, so straighten those legs out to start with. Okay, so first of all, I want to have a look at the length of the legs, because as you've heard me say in other videos, often our legs are different lengths. That can be a predisposing factor in our knee issues. But actually, looking at his legs, they're pretty even. You've got a relatively matching pair, which is good. The other thing I'm noticing, so first of all, I'm just looking at the knee. I'm looking for things like swelling. I'm looking for things like prominences on certain bones. Now, what I'm noticing here is that we've got quite a prominence on the top of the shin bone as it comes up. You'll see this is the tendon of your quad muscle. It's called the patella tendon. The patella is your kneecap. And it comes down and attaches onto this little knobble on the top of your front of your shin bone. In some people it's relatively flat, in other people it's quite prominent. Do you find when you're doing knee work it's a little uncomfortable, that those knobbles can grind into the floor a bit? Always best to wear knee pads if costumes allow, but certainly in practice, so that we're protecting those. That's the attachment of this quad muscle. In the growing phase, we can have an issue where typically when we grow, the bones grow first and the muscles play catch up, and it can actually be about 6 months between a bone growing and a muscle catching up. So for a certain period of time, that quad muscle is a bit short for the bone it's now going over. So it starts to tug on this bit here. And when you're in your teenage years, so kind of this is typically between the ages of about 13 and 17, the end part of the bone is not bone, it's actually cartilage, because cartilage can grow faster. Cartilage is prone to inflammation, so if you've got a quad tendon tugging on it, it can start to flare up that area. Then as it becomes bone, as you go out of your growth phase, you start to what's called calcify, and those end parts of your bone become bone. It can remain more prominent. Anything in the body that is being rubbed or loaded will tend to thicken itself to protect itself. So it's a little jigsaw piece that we might have had some growing issues there. Okay, so I'm going to look now at the knee joint itself. And first of all, I just want to have a little check of the knee cap and how it moves. So I'm just going to kind of play ping pong with it between my two thumbs, and I'm looking for the glide of that and looking to see if there's any grinding going on. And I can also assess doing that whether there's any fluid underneath there, if there might be any swelling. I don't notice any swelling on the surface, which is good, but sometimes deeper we can find some. But that feels pretty good to me. No pain as I'm moving that. No. But what I am feeling is that it's a little stiffer going outwards than inwards, and I can feel it's pulling on the patella tendon that's beneath it a little bit in there. And as I just press into this tendon here, I can feel it's a little bit thicker on the inside than the outside. So these are all, again, my jigsaw pieces. There's more load coming through. And as we saw in the standing, there was a little bit of wobbling. It's going to load that inner side of the kneecap, or the tendon of the kneecap. Okay, so I'm now going to bend the knee joint up. So I'm going to move around this way. Just trying to make sure I'm not blocking the view as we do it. So if we bend this knee up, so what I'm going to do here is just see how far we can bend the knee. Any pain as I'm doing that?
Slightly.
Slightly, okay. And then as I stretch the leg out, just going to see if we have any hyperextension there. A little bit. Any pain there? Mm-mm. No. Okay, if we bend that knee up so your foot's flat on the table. Now we've made that tendon nice and prominent there. And remember that we've got our two little meniscus cartilage pads just living inside here. So I'm just going to, with my thumb, just press into this side. Any tenderness in there?
A little bit.
Little there, yeah. This side, not tender or is tender?
A little bit.
A little bit, yeah. Okay. But this inner one to me just has a little spongy feel to it as well, which tells me it might be a little inflamed, and that might be coming from that inside edge of the tendon there as well. Then I'm also going to press on this spot here, which is where the thigh bone is meeting the shin bone. We call it the joint line. Any tenderness there? No. Okay. So that's a ligament there that has a little attachment into the cartilage, so sometimes that can be involved too. And then I'm just going to bring this leg up here and just putting my hands over that joint line, I'm just going to do a little turn out and turn in. How's that feeling?
Good.
Good, yeah. So that feels quite smooth in there. Then we're just going to slowly lower that leg down. Any issues as I'm coming down this way? Okay. Sometimes if you've got a meniscus injury, you get a little bit of a catch as that knee is coming down. Okay, now we know that we had some weakness when we were standing up, so I want to have a look at the muscles around this area, and particularly we're going to look at the quad muscles. Now, quad means 4. If you don't know what your quad muscles are, go and look at the hip joint video and you'll get a breakdown and some images of what the quadriceps muscle looks like. But it's got 4 muscle bellies that all become that one tendon that comes down. We've got a middle quadricep called your rectus femoris that comes all the way down the center. And then on the inside, we've got an inner one, on the outside an outer one, and then there's a 4th one underneath that middle one. I'm quite interested in these inner and outer ones because, again, I want them to be balanced so that that knee is held in a nice controlled position as he's plie-ing. So what I'm going to do here is I'm going to pop my knee under your knee so that I get it into a semi-bent position. And then I'm just going to have you straighten your leg and I'm going to resist you with my hand. And I'm looking for weakness here. Now that feels a little bumpy to me, a little rocky, and it's a little tight in that area. I'm just going to switch sides here because I want to compare it to the other one. We always want to see the difference. Straight, whoa, completely different. So we've got superhuman power on this side, and this side is really a little bit wobbly. So that's obviously been played out with what we've seen when he was standing. I'm just now having a little palpate, so using my hands to feel the bottoms of the hamstring muscles so I can assess the tone there. And then if I get you to bend your knees so your foot's flat on the table, and then slide your heel towards your sitting bone, and I'm going to resist you. Oh, lovely, beautiful, powerful there. Just going to scooch around, and then bend this knee up, and then bring your heel towards your tailbone there. Not too bad, but not quite as strong as the other side. So again, we talk about inside to outside balance, but also front to back. So the hamstring's quite strong, particularly this inner quadricep muscle known as the vastus medialis, if you want to know your anatomy, is a little weak. So the job of that inner quad muscle is to do what I just did there, which is the last 15 degrees of extending that leg. So just straighten the leg out. So its job is to fire up, and it should be that little teardrop shape there. So this would be a good exercise for you to do, is just doing, have your knee, you can do it in a seated position. I'll just demonstrate it here. Just straighten that leg out and back down. Try and be mindful to keep that knee in the midline, not let it roll. So straighten the leg, good, and down. And you can hear a little bit of creaking in the knee as we go through there, because it's a little bit unhappy at the moment. And then up, good, and down. Okay, so that would be a good exercise for him to do to help stabilize that knee. Okay, now another muscle I'm going to look at is the gluteus medius muscle, because it controls a lot of our knee alignment. And that's one that's right up in the hip here, on the side of the hip, a little teardrop shaped muscle. If I just pop your hand up this way, and it's just up in the hip here. I'm just going to run my fingers in there. You feel that there? I'm twanging across the fibers of it here. So that's the glute medius. And again, that feels a little tight there. I'll just come round and compare that to your other one. Yeah, very different. So this one haven't got that twanging going on. So that's not bad at all. So we want to loosen up. I'm knocking my skeleton over again. I want to release up this gluteus medius muscle, because it's the one, you've probably seen this in several of my videos, it comes up in a lot of stuff, but it's important. When we saw that knee was a little uncontrolled, it's the gluteus medius that's really one of the main controllers of that. If it's short and tight, it's weak, and it's not allowing for that control. So we need to address that muscle. So I'm going to grab a ball, and I'm going to show you how to release that muscle. If we're doing any strength training exercises, we need to make sure that we're doing it with the muscles in a neutral position. Okay, if the muscles are tight and you try and do the exercises, you're actually reinforcing the tension. So we want to make sure that we're addressing the muscles, making sure everything's as neutral as it can be before we go into our exercises. So for this one, we're going to pop the ball right on that spot there. Does that feel like it's on it? And then just roll so your body weight's on there. Much better to do this on the floor, on a solid surface. Then what we're going to do is get the body into a piriformis stretch position. So you're going to bend this leg up so that you've got 90 degrees and 90 degrees. Then with this one, you're going to turn it out and put your foot on with this leg. Sorry, with this one. Turning you into a pretzel here, so we're going to put your foot on over here. There you go. Got you. Okay. Then hold on to the thigh underneath there. So we've got the ball resting under here. Then what I'm going to get you to do, so if you're on the floor, do this up against a wall, and you're going to lean into me. So roll over to me. Can you feel that ball going in there? And it just sweetens up nicely onto that muscle. And just relax there and hang out. So you're just letting gravity fall in there. And you want to hold that for about 20 seconds, and that will release up the muscle. Okay, just come off that. And I'm just going to roll it, just relax the moment, I'm just going to roll it a little bit higher. Let's try that spot. Does that feel? Yeah. You can normally tell when you're doing this, you'll be like, ooh, that's the spot. And let's do another round just there. So lean into me, I'm being the wall. You can do this up against a wall at home or in your studio. Hang there for about 20 seconds. It's normally a bit ouchy for the first few, and then it normally desensitizes and you feel that tension dropping out. Beautiful. Okay. All right, let's take that away. Okay, so now we've released that up, bring you back into a standing position. And let's see if having opened up that spot, that we've helped a little bit with the stability. So another thing, just before you head off, another thing you want to do is whenever we're doing balance stuff, you really want to think about pulling up out of the joint. Remember that joint has got two bones meeting, and quite often when we're trying to protect a joint, we tend to push down and try and protect it this way. But really what you're doing is squashing the joint surfaces together, and it's actually aggravating. So we want to try and keep some space in that joint. And even though you're in parallel, imagine that you've got a sort of spiral rotation going on all the way through the legs there. Okay, so now we're going to come onto this leg, keeping that nice spiral rotation, and you're going to do your plie again now. Little crack there, little wobble, but we're a little more stable on the hips now. Try it one more time. Good, and come back up, good, and down. So we've still got a bit of weakness there. He's still in the early phases of this, but just releasing up that gluteus medius muscle has already allowed for that knee to start to get more control. So it's not all about the knee. You need to be looking at the hip higher up. We'd also, obviously, in this scenario, if we had more time, we'd go into more of a lumbar spine exploration to see what the jigsaw pieces are there. But we'll do a whole other video on lumbar spine issues and how to address those, but just know you've got to go and look there. For other people, there might be issues at the foot that want to be addressed. Remember, the knee is caught between the two, and it's the middle of that corkscrew, and it's vulnerable. So make sure that you're addressing the foot, the hip, the lower back when you're looking at knee issues.